was 6 weeks before I could really put weight on it and even bend it. So 2 months before I really started.
Sean Warren turned to Brett Fischer at the Fischer Institute in Phoenix after having surgery on his left knee at the end of last year. Sean is no stranger to the Institute, having utilized it 7 years ago to rehab his other knee.
Physical therapy is voluntary as an adult. I mean, you don't have to go. If you don't like it, you just don't go. But I wanted to get better for all the different reasons, including the hike. Sean
not only wanted to get back to doing his daily activities, he was hoping he could be ready to hike the Inca Trail to Machu Picchu in Peru this summer. One way to get him there was trying a new therapy technique called blood flow restriction, or BFR.
It feels a little bit, or quite a bit, like putting a band on to do your blood pressure.
BFR uses a specialized FDA-approved tourniquet system on an injured limb with a personalized and specific pressure to reduce blood flow in the leg or arm. By doing this, a patient can lift light weights and see benefits as if they were actually lifting heavier ones.
Basically what BFR, blood flow restriction, is, it's a cuff that measures how much pressure it will take to occlude 100% of your blood flow. Research has shown that if I occlude 80% of your arterial flow and 50% of your arterial flow in your arm, I'll create this effect. And what this effect is, we use weights that are super, super low. So we go to 10 to 20% of 1 rep max, which is super lightweight. We use the cuff, and now the brain thinks that we're using heavy weights. We're tricking the brain into thinking we're lifting heavy weights, and we're not. So the muscles and the joints are happy. The brain then tells the pituitary, hey, shoot down HGH, shoot down IGF-1, which are hormones that the body produces to help heal and produce strength. Also increases protein synthesis, which is the bodybuilding, it was the mechanism to repair tissue.
Owens Recovery Science trains and certifies physical therapists, athletic trainers, and other medical professionals in this technique. While the military, college, and professional athletes are utilizing BFR, it's not just for the elite.
Now it can be used for anyone of any age with total knee replacements, strains, post-surgeries of ACLs.
The protocol for BFR starts off with the patient doing 30 reps with 30 seconds rest. And then they go into 3 sets of 15 reps with 30 seconds of rest in between.
The patients who have been through previous surgeries, previous injuries, now can say, hey, I'm getting quicker, I'm getting fat, stronger quicker.
As for Sean, since incorporating BFR into his rehab program at the end of February, he felt like his knee would be strong enough for that 25-mile hike.
I would say, if you believe in science, then the evidence is pretty clear that this is effective at strengthening.
Seeing someone who has joint pain and they're getting their legs stronger, when they said, I could never have done this without this or reach my goals. And it's really a fulfilling feeling you get as a physical therapist, that you can say, I helped someone get over this hump.